before. I can hear you.
Oh,
yeah.
Are we live?
What are they doing?
This is,
Come
this is Senate Appropriations Committee again, and we are continuing our work on the budget adjustment, and we have the Department of Mental Health here to review with us their request in the BAA submission. And so we have Commissioner and staff, and I'm going to have you introduce your staff. We do have two new members of the committee, and Senator Perchlik is our vice chair and new to the committee, and glad to have him, and Senator Lyons, who you know well.
Sneaks up on us.
And so it will make communications between her committee and this committee more efficient, I guess. So with that, we will let you introduce your staff, put yourself on record, and review with us. And then, of course, we don't always adhere to your script. So if we have questions or comments or whatever, they'll probably come up as a matter of conversation. So why don't we get started with the request first?
Sure, thank you. For the record, Emily Haas, Commissioner for the Department of Mental Health.
Allison Crum, Deputy Commissioner for the Department of Mental Health.
And I'm Shannon Thompson, the Financial Director for the Department of Mental Health.
Okay, so you want to work off which document?
We
Commissioner?
typically work off the line items, which should be in line with the talking points as well.
Yes. Oh, our ups and downs? What?
Makes me fun.
Very technical term.
Oh, yeah, I do love the ups and downs because this is my legacy. Okay,
I like the big print.
well, I do too. Every year I appreciate it more. All right, so, I
Sure,
don't.
go ahead, Shannon.
You're gonna have Shannon run
Yes.
through the money? All right.
Okay. So I'll also acquaint you with the talking points. We have the gross amount for each line item and then the general fund equivalent. So as you're going through, if you're interested in how much general fund each line item is going to require, that's in the talking points. The first item is the University of Vermont Medical Center contract increases. This is increased salaries for the physicians at the Vermont Psychiatric Care Hospital and at MTCR, the Middlesex Therapeutic Community residents, soon to be River Valley Therapeutic residents.
That's the 371.
That is the 371, 852, and that is all general fund.
All right, the next one is rather large, 10 million.
The next one is the travel nurse contracts. That is travel nurses at both of our facilities as well. During COVID, we've sustained a lot of staff vacancies. And I'll let Commissioner Haas talk you through all of that.
Sure. So both BPCH, which if you don't know, the Vermont Psychiatric Care Hospital is a 25-bed facility here in Berlin for adults, hospital level of care. And the Middlesex Therapeutic Community Residence is a 7-bed residential level of care, currently located in Middlesex, soon to be at River Valley. Both of those facilities.
Is it in the valley?
It is.
Going down.
It's in the River Valley.
Very broad.
It's where the old tree farm used to be 100 years ago.
There are a lot of trees there.
Yeah, okay, all right, well, River.
I always call it Riverview, but it is Riverville.
I know, it sounds like a residential care facility. Okay.
But it is. So both of those facilities did experience significant staffing shortages. The department went through an exercise last year of a market factor analysis in order to bring up salaries for nurses, as well as increasing the shift differential, which and then a retention and recruitment bonus in order to offset travelers. Those didn't necessarily produce a high level of new applicants. It did help us keep current staff from going somewhere else. But the gap between someone who is on a traveler contract for say a nursing position and somebody who is working permanently is still rather large.
What is that difference? Can you tell us?
I can wing it and then I'll follow up with the exact. So depending on what level of nurse you are, there's an RN 1, 2, 3, and an RN supervisor. And I think they're making anywhere between $29 maybe and $40 an hour. Travel nurses are making, I don't know what their exact take home, but currently those travel contracts are around $150 or $130 an hour. Now the nurse doesn't take home that full amount. Some will go to a recruiter and then back to the agency, but the gap is still pretty significant. We are working to bring those travel contracts down, which we have brought them down since a year ago. In context, the swing on those contracts was massive. So in July of 21, we were paying around $76 an hour for a travel contract. And at the highest, it was $225 an hour. So we've come down over the course of time, just not as quickly as we've
So
been
did you
able
have to do like nursing homes? And that actually is not accept patients even though you had the beds because you couldn't meet the staffing ratios?
We had, there were periods of time where we did not have enough staff to do 25 beds. Right now we are at 21 beds, and that's more related to physician coverage. So right now we have a RFP for our physician coverage. The UVM Health Network is not going to be renewing that contract. And so we have limited psychiatry availability to serve folks. And every facility gets into a point where you want to balance the number of travel staff with permanent staff in order to honor the treatment and the safety of the facility, and so your patient care isn't being negatively impacted.
We understand that.
Yeah.
We also understand from the local hospitals the impact, because if you aren't able to get the full utilization, and
That's correct.
and so they're getting hit from the nursing homes that get
Yes.
staff, and they're
Correct.
and they're experiencing patients that can't be discharged
Yes.
or prolonged still stays.
Yeah, and we certainly see folks who are nearing ready for discharge that would need to go to, say, a nursing home. And so we see that across our healthcare system as well.
So, all right.
Is
Yes.
there any way, a few years ago, we passed a law here that would allow reciprocal agreements for
It's just a
nurses?
nationwide shortage.
You're talking about the
That's,
nursing
yeah,
home.
you're talking about the nursing compact.
Yeah, we do that.
And that has been helpful to transition folks who are out of state into our facility. There is a nationwide shortage in nurses, and then add a specialty nurse on top of that shortage, like a psychiatric nurse, which in psychiatry, it just exploits that shortage even more.
So how many contract nurses do you have right now?
I believe we have 42 right now.
42?
I believe so.
Wow.
And how
Go ahead, yes.
does that compare to the past? Like, has it
Sure.
always been around 40, or did you at one point get 10?
It's been significantly less. It's when we're at 25 beds, it's usually hovering between 10, 10 to 12, 10 to 14, depending on any given, month or quarter. And so we're at 21 beds with 42. 42 across 2 different facilities. That's also a shift. We used to not utilize travelers in TCR, but we needed to find a way to also keep those beds open during the staffing.
And what's been your max? Have you been up?
This is the max.
Okay.
Yeah, this is the most we've ever had.
Yes, so of the 42, you got 4 that are specialized nurses.
We have 4 who are serving in what's called a mental health specialist role, which if you think about a nursing department, you have your nurse who is managing the medical components of somebody's treatment, and then a mental health specialist is an ancillary service to the nursing component. So they're also doing interventions on the floor, assisting and facilitating groups and such. But it does not require an RN. And so we have contracted with traveling mental health techs or mental health specialists, which are not RNs, and I believe that's the point that you have there.
Well, I guess your vacancy savings do help offset because you're hiring the nurses, the contract nurses to fill vacancies, so just doesn't quite even out, does it?
Just not, isn't it?
Only 10 million.
Well, 3.5 versus 11.2, but that makes sense. All right, shall we keep going down through then? Next one's Washington County micro residential increases.
Yeah, so this, excuse me, this line item is for the Washington County micro residential increases. That is youth micro residentials, and they have some gaps, and they have a lot of vacancies as well, and they're not able to fill the beds there. And I'll let Deputy Commissioner talk to you a little bit about
How do you define a micro residential?
It's a good question. I think what distinguishes this in the community mental health system, we have lots of adult residentials. We don't use the term micro residential for them necessarily, but they are micro residentials in that they're small. It's the number of beds. We're not talking about a very large facility here, but this residential program is community based, and it's a program that serves youth for longer periods of time. So that's something we haven't had. So these residential programs can serve someone for 6 to 18 months. Versus crisis bed programs. And this is the only one that we have in the state that serves all Vermont youth.
And micro refer to the number of residents or
I'll have to check on the history of how micro was applied because I don't think it's based on necessarily the number of beds that are there. I think it's our way of it being a little less than what would be considered a residential program. So let me double check on how I think.
I think you have the answer over here.
It's when you have 4 or fewer.
Okay. It is based on, okay, thank you.
That's all.
You want to introduce yourself for the record, please?
Sorry, for the record, my name is Nicole DeStazio. I'm the Director of Policy for the Department of Mental Health.
Thank you. Yes.
And community-based, does that mean it's at a home, or how do you define that?
No, it's not a home. So that we do have programs that might wrap a youth in their home. This is where they go to live. This is their residence.
But
So
it could be a home like,
it'd be a home-like setting, yes. So yes.
so not somebody's home, but it could have been a house.
Yep.
And just, their
Generally,
apartment rented, or they own these?
Either way, they can do either. I think it's a combination depending on the DA. But it's a home-like setting operated by the agency.
And then you have staff that are there at the
Yep.
home with them.
They provide an intensive service program for that.
Okay. Center Alliance?
There.
Are any of these kids, have any of these kids been adjudicated within the judicial system, or is this all?
Are you talking about justice involved kids?
Yeah.
Certainly. So there are youth who are placed there after being involved in the justice system. There are youth placed there out of being in DCF custody. And I think what makes this program special in terms of their staffing issues across the system and at all of the DAs is that this program in particular is both a step down and a preventative for inpatient care. And when staffing there, we actually did an outreach at the end of 2021 to ask the DAs, we called sort of the stop the bleeding issue of when we're talking about this is an emergency and you've got a staffing crisis, where are the places where you're really hemorrhaging staff and that gap is causing major issues on the system. It was emergency services and it was programs like these. And this program in particular had the lowest staff salaries. So there was a concerted effort to increase salaries at the residential.
And so this this wasn't a part of the staff salary increases that we put in place for VAs last year. How does that compare?
Right, so
Can
this,
we put that?
This is on top of the 8%.
This is on top of
This is on
8%.
top of 8%, so it's more of an incentive to keep folks who are engaged with counseling services, I guess.
And is it one time?
No, I suspect not.
We can't talk about it.
Okay.
2024 budget.
But when you're talking about salaries,
Right, well, it
and
could
what-
be just a retention bonus.
I thought, but they didn't describe it as such, but
Right.
is that how it was paid out? Or was it a salary adjustment to attract?
This is a salary adjustment to retain and attract.
So they can't say, but the answer is yes, it's an ongoing cost. Okay, now we have legal aid.
Yes. So just, if it's okay, I'll step down to another line item that is related to the Washington County Mental Health
Sure.
micro-residentials.
Oh, yeah,
Um,
that's the 48.
This is a shared cost with DCF, so you'll see a line item down below, funds transferred from DCF for the Washington County micro-residentials. It's exactly the same amount, so we're sharing that cost 50-50.
Did they come in for a budget adjustment too for that? 48,000? DCF.
I don't know off the top of my head, we'll look at the details.
S3?
S3, so the Vermont Legal Aid, this is $300,000, and $250,000 of this is going directly to the Vermont Legal Aid, and the remaining $50,000 is going to
Conflict counsel. And so currently, the way that the Department of Mental Health is represented in some cases where competency and sanity is in question, we utilize conflict counsel to represent the department. And that was part of S3 legislation that came out at the end of the 2021 session. And then the 250 is for 2 positions with Vermont Legal Aid attorney positions to represent the consumers who are in those same hearings.
And that's probably an ongoing need then.
The next line item is
Ready to go on? I'm just looking to see if we got questions. All right, we'll move on to service level agreement, ABS.
This is probably something you've heard from all of the departments. This is an increase to the ADS service level agreement, Agency of Digital Services. That's just it's an internal
So-
service fund.
Almost like fee for space, okay.
Private-
Oh, this is PNMI.
PNMI.
Mhm.
PNMI is the private non-medical institutions. This
And
is
give
a,
Senator Sears who's not here heartburn because group homes rate setting. And so this is part of what we were saying is the old base year for rate setting in 2019 is unworkable. What facilities do you have that are licensed under as PNMI?
we have many of them. I'm happy to provide a list for you if that would be
It
helpful.
seems, yeah, it's at 420,000 total. Yeah.
Right. Yes, we spend about $8 million a year. So this is in the ballpark of a 4 or 5% increase. But it's meant to be an inflationary increase because rate setting does a 2-year look back and it doesn't cover.
Yeah, the
costs.
current costs now and operating costs are so high. And we actually asked rate setting to do this for long-term care, for nursing. And so is this all part of that overall looking at those rate setting, rate-setted provider entities?
We'll have to confirm with you on that. We're not necessarily involved in this piece of the conversation around the nursing home facilities.
But you use the rate-setting structure that's housed in DEVA.
Mhm.
Okay, so they're doing, thanks, nothing. Okay. So all I'm saying for the committee is there are other entities subject to rate setting. Nursing homes are one. DCF operates group homes, like to a Ford Depot, and they're rate setted, and they're And so what was happening is rate setting was lagging, so, and using a base year of 2019 and costs have just ballooned, and they weren't able to really operate with the level of reimbursement. And we had language in the budget, of this year's budget, to actually go in and make some adjustments in that rate setting structure, because the level of reimbursement was totally inadequate. So, and the collateral impact, of course, was nursing home patients were backing up into hospitals, and you probably have heard complaints about that. So, okay, that's 420,000 grossed up.
Yes. The geographic equivalent of that is 189, 419.
Of the 372,
Of the
And
420,000,
then
the general fund need for that amount is the 189.
okay, so you've got general fund over here, 47.
Yeah.
And then you've got the 372, and out of the 372, the general fund is,
It's, it's 189 less the 47. So the 47 is for room and board. We pay general fund for the room and board.
yeah,
And then, of course, there's 38.12 cents, I think, in a Medicaid dollar.
so that's why you're splitting.
The next line item is transfer of funds to DCF for Northeastern Family Institute, NFI, for the room and board. We discovered that there was room and board within the current NFI case rate. We paid them through a case rate. And so Medicaid does not cover the cost of room and board. We need to pull that out and give that money back to DCF so that they can pay their room and board portion, and we kept enough for our room and board portion.
There's the 48,535 again, the other hand, yeah.
And then you've got the corresponding down to the DCF budget.
Oh,
So it's all moved into this budget.
but they aren't asking for anything more, they just moving it out of the base. Okay. All right, any other questions on this? These are, we're getting down through, so your total, subtotal of increases is almost $9 million. Right, the biggest, of course, is the contract nurse. Other questions? The other, do you want to talk about the money that you have in, the one time?
Yes, we can certainly do that. Are you referring to
I'm talking about
youth
Southwest.
inpatient? Sure. So we also have a request for one-time money related to youth inpatient projects that is currently in the feasibility study stage. Some history, last spring, we put out an RFP for inpatient availability for youth who are experiencing complex medical issues that perhaps a standalone psychiatric facility couldn't meet those needs. We did see some youth hit our system who needed inpatient care, who either waited for a long period of time or were served on an adult unit, which is not something that we would like to see continue. It also diversifies from the Brattleboro retreat, offering a choice for somebody who is voluntary to choose a facility that they would like to go to. And then also healthcare integration into a medical unit. So that RFP was posted in the spring. We had one bidder at that time who needed to pull from the project. And so we put it out to bid. And this past, over the summer and this past bid, we got one response. And that response was Southwestern Vermont Medical Center. And that project is currently laid out in 4 stages. So they're in the first stage, which is the feasibility part. Once that is complete, which is at the end of March, we'll see a clearer picture of next steps for a CON, if SVMC continues on with the project. let's say SBMC doesn't continue on with the project, we would then put it back out for bid and continue to work to find a facility who would like to engage in youth inpatient care. The reason why it's in here is so that we can get started on it as soon as possible.
So, and just thinking about the number of kids who are in the northern part of the state, and how, what you did indicate diversification, that's true, but it's also further south.
Two facilities both on the Mass border,
Yeah.
essentially.
I'm just wondering whether you've, I'm sure you have, I was going to say that, if there are any other potential places that are further north than Brattleboro.
They did not respond to the RFP, and that's part of, we post
Part of the
those.
problem.
And, you know, I'm sure that there are very good reasons, right? One of the initial responders was the UVM Health Network.
Yeah.
And it wasn't, you know, they were unable to move forward with it. So, you know, we put it back out for bid. And this is the group that bid on it. And so I also, you know, this Southwestern Vermont Medical Center also has a nice collaboration with United Counseling Services. They operate a pediatric urgent care kids PUC program, which offers supports to youth in order to hopefully divert from needing inpatient level of care. And that relationship has been very successful in that area. The other key point is with DC kids who are involved with DCF, there's also some DCF residential facilities in that area as well. So we certainly understand that it's not in the north and that it's another potential unit in the south. There is Champlain Valley Physicians Hospital that has an inpatient youth unit, and
That's in New York.
it is right across the lake.
Right,
We see,
bring that one up.
we do see some youth
That's
go over
closer
there.
to Chittenden County than Bennington.
Well,
It is closer.
I'm thinking about the numbers of kids and where they are coming from, you know, these are kids.
Yeah,
And it's hard to take, you
And
know,
families
parents
to-
have to drive all over the place.
How many are we talking about?
so they're still in a feasibility study. Our RFP was looking for anywhere from 6 to 12 beds, depending on what the information unveiled through that particular study. Other things to keep in mind is, you know, this is our highest level of care, so our most expensive. We've also done in the past year a lot of investments around community levels of care. So we talked a lot last year about mobile crisis and mobile response. We have alternatives to emergency departments in order to support youth. Our goal is for folks, you know, to, when they need inpatient care, that it's available to them, and right now it's not available.
It sounds like the curative that you're talking about is not one that a mobile unit might respond to, but they would have to, it would be a handoff to
Yes, it would
this
be
level of.
potentially, yeah,
Well,
potentially.
I would think you're saying the complexity of care and high cost, it seems like it would take more than a response, you know, in the middle of the night to address that child's needs.
Potentially, yeah.
So that's just in the feasibility.
It's in the
Okay.
feasibility stage, and like I said, that gets done at the end of March. And we're in a position where we would like to move as fast as we can, so that we can, you know, serve our youth in the best way possible. Try to operate under developing resources that people can get care when and where they need it and want it. And we do see this as an opportunity to do that for youth who need inpatient care.
We'll have more discussion on that, but also.
Is there any interest across the lake? Just to ask that question.
Tell me what you mean by that.
To have it be across the lake
Oh,
again.
Champlain Valley.
Oh, at
Yeah.
Champlain Valley, well, they already have a youth inpatient unit. Yep,
in taking our youth.
they can take our youth who are voluntary. And I will say most people who come into the system, whether that's adult or youth, are voluntary.
Yeah.
And you can go to Champlain Valley if you're voluntary.
Do you have we used it?
I believe so, yeah.
Is there any,
Do go there.
would we ever have like an MOU with them? I don't know what kind of relationship we could build in another state, but
For folks who are voluntary, it's very easy to send folks out of state. It is the parameters and the restrictions around, once somebody comes under the care and custody of the commissioner, you are limited to in-state placements. And we don't want folks to come under the care and custody unless it's absolutely needed to. And most youth transition to voluntary status once they get into inpatient, which we've also talked about. Is it just involuntary for transport to say Champlain Valley? But the EE, the emergency exam or involuntary status really impacts somebody's ability to go out of state. A voluntary can go out of state.
And the children in the custody of the DCF commissioner, in fact, are routinely placed out of state.
That's true.
Interesting.
the compact that we passed last year, trying to remember what that would have, that was a DCF placement of children, but it was in homes and it was, so it's not related to. mental health issues.
In state.
Yeah.
Placement of
Yeah.
children. And
What's the dollar amount for the Southwest? So
It's 9.25.
that's the request. And where is it in the, so that would be in this.
In the one-time section.
it's in
Oh,
the
yeah.
original letter.
I
It raises-
keep forgetting.
Yeah. It's hard to consider what that price tag should be, considering the feasibility of the study hasn't even been completed.
They did submit a full bid that included the feasibility and what, their estimate of the final project would be. So they did submit a full bid, and that was what we utilized to assist in determining the ask.
So the 9.2 is the full project.
I'd have to go back and double check that they put the 9.2. There was some feasibility money set aside and there was some other layers to that, but we can certainly double check that.
Okay, well, we'll have.
They're not building it. If it moves forward, they are renovating an existing space potentially, not building something from the ground up.
Yeah, and they gave ranges of between this and this, so we tried to, put in there what.
So, well, we'll see what the House wants to do. One of this is just the timing of the BAA vote relative to the big bill and more time because I don't know what the cost of the feasibility study itself is out of that total estimate of over 9 million.
The feasibility study, I think was $50,000.
And you funded that out of your base budget or that's part of the 9?
We funded half of it, am I correct in that?
Correct. So that's a very modest piece relative to the total request. Other questions?
A lot of work.
All right, well, thank you for coming in. If there are no more questions, then we won't torture you anymore. And
I wouldn't have defined it as that. Those are really good questions and we want to talk them through, so thank you.